Hi, I'm attorney Julie Hauf, and today I wanted to talk about how you know whether you're being charged for the right spinal decompression procedure. We're going to go straight to the CPT book as it has several things that can help us figure out what the right code is. And knowing what the right code is important, why that's important, is to make sure that you're being, first of all, charged for the right thing, because the more complex code should, in theory, have a higher charge. You might be able to charge for multiple levels with another code that you can't with the right code. There might be different things about different codes that can go along with it, such as fluoroscopy or use of a microscope, or knowing whether or not a co-surgeon or assistant surgeon can properly be charged under the AMA's guidelines. So what the CPT book tells us is that the primary approach and the visualization define the service. And that's actually so important that in the 5 or so pages that talk about these different codes that can be used for these procedures, they give the definitions 3 separate times within that same short span of the book. So what they define for us is percutaneous, endoscopic, and open. So those are the 3 different types of approaches that they can use for this type of procedure. Percutaneous is image-guided procedures performed with indirect visualization. Endoscopic would be spinal procedures performed with continuous direct visualization of the spine through an endoscope. And the open procedure is going to be the spinal procedure performed with continuous direct visualization of the spine through the surgical opening. Now, indirect visualization is defined as image-guided, like a CT or fluoroscopy, not a light-based visualization. The direct visualization is that light-based visualization and can be performed by the eye with surgical loops, microscope, or endoscope. So that's what we're talking about here to define what the approach is and how the surgeon is seeing the surgical field. So what different codes are we looking at? Well, one of the primary codes that we would see for a procedure like this that should apply but may not always get billed is 62287, which is for a percutaneous decompression procedure. This is the code that does not allow for an assistant surgeon, a co-surgeon. It doesn't allow for billing at multiple levels. It's a lumbar percutaneous decompression code. It also gives a list of codes that should not be billed with it. They give the injection procedure for a discography code because the injection part of the procedure is already included within the 62287. But additionally, they tell us other things like fluoroscopy can't be used because, again, it's included within the procedure. So there was a sort of recent update to it a few years back, but what it says is that this is a decompression procedure, percutaneous, of the nucleus pulposus of intervertebral disc. Any method utilizing needle-based technique to remove disc material under fluoroscopic imaging or other form of indirect visualization with discography and/or epidural injections at the treated level when performed single or multiple levels in lumbar, meaning this is a procedure for the lumbar spine. This is super important. Any needle-based technique to remove disc material under fluoroscopic imaging or another form of indirect visualization is required to be billed at this code. So what are some of the other codes that we're seeing that are being used to bill that may or may not be appropriate? Let's figure that out and let's get the basics on them. So one of them is 63020 for a cervical laminectomy or hemilaminectomy with decompression of nerve roots, including a partial facetectomy, foraminotomy, and/or excision of the herniated intervertebral disc. That's 63020 is for cervical, 63030 is for lumbar. When you get into what that code is for, it requires a bone drill to use this. If you don't see a bone drill being talked about in your operative note, or there is another piece of surgical equipment, a surgical device that's being used, go look it up. Figure out whether or not it can be used to drill through bone. If not, and you're using this code, 63020, 63030 is the code that's on your bill, chances are it's not the correct code and the procedure is being both up-coded and then very likely overcharged. So then what's another option? Well, 63056 would be the transpedicular approach with the decompression of the spinal cord equina and/or the nerve roots for herniated disc. The lumbar code is 63056. Now this is a code where you can charge for an additional level. So for example, 63057 is the charge for that additional level. that's a different approach, it's a different visualization, and it's also you're able to bill additional levels for doing that. So what's another code that we sometimes see is 63075, which talks about a discectomy anterior with decompression of spinal cord and or the nerve root, including an osteophytectomy. Cervical is the code for 63075. This is another code that can have an add-on code for an additional level. So there's a lot of things you can see by looking at the bill, looking at the operative note, making sure that you are being billed for the correct code. And these pages should be with you if you're suspecting that you have been overcharged for a procedure. These pages should be with you at every single deposition of the coding rep or the physician that's done the surgery to make sure that they've charged you for the right code, which means you have the right amount on your bill. There's not things that should be unbundled and upcoded, because it's the AMA guidance, it's the CPT, it's not just Medicare edits that goes into what can and cannot be charged for these procedures. There's a lot of items that you might see come off of your bill, or if they've been upcoded, the cost is going to come down as well. So there's a ton of useful information in here. We're going to keep talking more about this because these are some of the most common billing issues that we see on spinal surgeries, but this is a first step to help you figure out how to make sure you've got the right code. So make sure we know about the visualization, and make sure you know what approach is used by the physician, because that's going to be half the battle to figure out that you've been coded the right code. Thanks very much. Any questions, you know where to find us. Stay safe.